This is how my sister passed away from her wisdom teeth. Sammy got her wisdom teeth surgery done, but she didn't finish all her antibiotics because it was making her a lot. And
yes, common side effect of antibiotics is diarrhea.
The bathroom. So she stopped taking the antibiotics, and then that eventually led her to getting an infection, but she didn't know this at the time. She was getting sick pretty much every month.
What is even worse is that she might have had a stomach infection caused by a new bacteria, such as C. diff. That's short for Clostridium difficile. And this typically happens when someone's on antibiotics long term, or too many antibiotics, or antibiotics that target a huge amount of bacteria.
She was in college at the time. When she would go to the campus doctor, they would just say, oh, it's a cold, oh, it's a flu. But she would be getting sick, I would say, once every month. And then eventually there was a certain point where we didn't see her for a while, and she came back, she was really, really skinny. She lost a lot of weight, and
I have a feeling that she had C. diff because she lost a lot of weight, probably due to diarrhea and limited food intake.
this was during my mom's birthday, so we took her to the hospital.
She said she was sick every month. When I hear something like that, something is definitely wrong with the body. This necessitates going to the doctor as soon as possible, and depending on the severity of symptoms, then you would go to the emergency room.
Right after my mom's birthday, and pretty much they figured it out that it was an infection that was in her blood, and she had endocarditis.
Endocarditis is inflammation of the heart.
She had to get brain surgery and didn't make it for the heart surgery. Another thing also was the doctors and nurses that were taking care of her did not treat her very well. From my family that was with her pretty much every day while I was at school, they told me that the nurses and doctors thought she was on, because she was very skinny and she was sick.
I am skeptical of this statement. Doctors and nurses, they don't need to assume, because hospitals, they do drug screenings, and blood tests, they're extremely accurate if you're on some kind of illicit drug, and we test for like so many of them at the same time.
Keep in mind, my sister has never done stuff like that. So
I hear family members saying this all the time. My sister has never done stuff like that. I mean, a lot of people, they don't tell anyone about their drug problem. So, I mean, drug tests, they'll confirm or deny their theory or not. But I hear all the time, like, patients' family would come in and say, like, oh, they never done this drug. And then the blood tests totally come positive for that drug, like heroin or some other illicit substance.
there were just multiple times where she would ask for things and the doctors and nurses were apparently rude to her.
I hear people say doctors and nurses are rude all the time. I could be wrong, but I'm guessing that the patient was frustrated, so the hospital staff got frustrated back at her. So that's why she probably thought that the staff was rude.
Yeah, I remember after she did her brain surgery, I never was able to talk to her because she couldn't wake up. So I know my dad and my mom said that she did wake up to talk to my dad, and she said her last words to my dad, and then she went to heaven. The reason why I'm making this video is because I feel like a lot of people don't understand how important it is to take their antibiotics after wisdom teeth. And if you do understand that, props to you. But
Yes, antibiotics are important. If used correctly, such as following directions and completing entire treatment duration. When wisdom teeth are removed, your mouth is just an invitation for bacteria to go into your body through an opening.
a lot of people that I know didn't realize how serious it was, especially Sammy. And when I got my wisdom teeth taken out, I took it very seriously. So, yeah.